Hi, I'm Dr. Mike Milligan. We're here at Dr. Woody Oak's Excellence in Dentistry meeting in Sandestin, Florida. It's an annual thing. If you haven't come to it, please do. You get so many great speakers, and then the camaraderie of all the dentists around here. You learn so much. Just come. But I have one of the keynote speakers with me here. This is a real treat, Dr. Brady Frank. Brady, thanks so much for being with us.
Hey, thanks for interviewing me.
Oh, you bet. And I've known Brady for a while, and he talks on implants. Now, if you're not doing implants, it's probably because you fear that. Brady is the guy that makes it simple. You need to listen to this. You need to take his course. Brady, talk to us about what you spoke about in there. You've got three different things in particular that you talk about with implants. You make it simple for the general dentist. Talk to us about implants.
Yeah, so I guess I'll go over those three procedures that you're talking about.
Good.
Number one's the no drill implant procedure. Number two is the one drill implant procedure. And number three is the 3-in-1 implant procedure. And I think dentists over the next 5 years have this neat opportunity.
We do have a great opportunity right now, golden age right now in dentistry with implants.
Yeah, because group practices are really expanding. Yet fee-for-service stuff, much like implant dentistry, is this gap. And a lot of the practices now, the best practices are increasing, but a lot of the practices kind of in the middle are not doing so hot.
Right.
And so implants can be a game changer for those folks.
For those dentists out there, right.
So I'll just explain the no drill first. No drill implant procedure basically is a great intro procedure for someone who doesn't place many implants, or someone who does, is experienced with them. We extract the tooth and utilize an instrument called an osteoconverter. It acts as both a bone condenser and an osteotome in one. That goes up and it converts the oval-like socket site to more of an osteotomy. And you can actually leave that in place there. You can see now our socket site is it more of a cylinder. It takes the curve out. And we can actually leave that in place as the implant. Go back and put on a crown and abutment. So that's the no drill. And the one drill is usually utilizing a sequence of 4 or 5 drills in a sequence. That's the traditional Branham arc, traditional.
Right.
And the one drill techniques on the market today, basically in one drill, step up to that size implant that you're going to use. So basically you go in with your pilot hole and then use one drill, which creates the same osteotomy as what used to be a process of 4 different separate drills that you had to change out. So that's what's new in implant dentistry right there. The third one's the 3-in-1 implant procedure, which involves doing one of the 5 minimally invasive soft tissue approaches. On the lower, you can use a mini envelope, which kind of opens up the gums without sutures. And then you use a high-speed handpiece for the initial pilot hole. Place your implant, hopefully or preferably with a one drill technique. And then prep that abutment immediately for a crown. So in the same appointment, you're placing the implant, prepping the abutment for the crown, taking an impression, and cementing the permanent crown in 6 to 8 weeks. Thusly, you've got a implant abutment and crown procedure, which I think most guys are charging $4,000 to $6,000 for. You're doing that in 2 appointments. And here's the real neat thing. Because you're leaving the final abutment in the mouth, right when you do the procedure, the periodontium is creating a seal and basically attaching to that abutment via a perioseal.
Right.
Because you've heard about all that cement underneath the abutments. Have you heard about that, how it can cause bone loss around the implant?
Yeah.
So this way, when you cement the implant on 6 to 8 weeks later, you've got a perioseal, so the hydraulic pressure of the cement is going to squirt up and out. Exactly, when you cement the crown.
Implant, but you meant cement the crown.
Gotcha. Yep. When you go and cement the crown on, the hydraulic pressure is going to force the cement up and out, not down around the implant, because you've got that seal there.
So you don't get that bone loss, right?
So anyway, those are the 3 procedures basically.
Brady makes this so simple for the general dentist. And he'll show you which ones you don't want to tackle. But if you're a general dentist and we were talking with Dr. Vandermolen today.
Yes.
A friend of mine for many years, and he recently took in November your course.
Yes, took in November.
He's taken 100 plus hours of CE on implants. He's been doing one a month. But after taking your course in November, he's done like 22 implants.
Yeah, I think
just in the first quarter of this year.
Yeah, he just took it 3-4 months ago. Did
Lee Osler took your course. Fabulous. Chris Griffin took your course, tells me. Stephanie Moen tells me took your course. And say, this is the course to take, Brady. So I'm telling you, this is the course to take.
Well, it's an.
I'm going to take his course.
You're going to. That'd be good.
I'm going to take his course.
So
I'll tell you that right now. I'll be out to take your course in Oregon.
So, just to speak to those of you who have taken a lot of CE, if you've taken a MISH course, done a Maxi course, if you've done a GARGE course, 85% of the CE and implants today is taught by specialists using specialist tools, techniques, and protocols. Right. And myself and some other general dentists train course via systems that are using GPs, tools, techniques, and protocols. And so using those techniques, you can easily do implants side by side, a quadrant of crowns or some composites.
You showed many slides in there today in your talk where you were doing endo, post crown, right next to an implant abutment, and take the impression for the crown as well, all in the same appointment.
Absolutely, and I think that's where implant dentistry is going. If it takes 5 or 10 minutes to place an implant and prep a crown, it then becomes a shorter procedure than a core and crown on number 30. And so the problem is our fees are so high now for implants, and I'd encourage everybody who does end up adopting these techniques to give the patients a break. Not always, but the income that you generate through the procedures makes the practice a whole lot more profitable. You can take that and start to bless a few folks by bringing the fees down.
Bless the patients, bless the staff, but also bless yourself with the increase.
Absolutely.
It just makes it easy. He shows you which ones that you might want to continue to refer to the specialist. But all of those procedures that are so simple and you can do in 1 to 5, 10 minutes, you give us the information to do that. Incredible.
And by the way, I'll give you a couple of the procedures I described. I realize I'm not that great at describing things, so I'll give Mike a couple videos, and at the end of this, he can put them on, condense them down to a minute, and they can take a look at them.
We'll put those up. Now, one of the things Brady talked about in there was he's got a high volume practice. He does a lot of wonderful full mouth type cases, a lot of crown and bridge with his implants and all. But he was saying that he spends 10% of his time doing implants, yet that is 50% of his revenue compared to all of the rest of the practice. That was pretty impressive.
Yeah, I think with implants, what we have here, what the issue is implant fees are so high, yet the procedure time is so low.
The way you do it.
The way I do it, and not just me.
Cherry picking the ones that can be done quickly and profitably by a general dentist and safely.
Absolutely, and so in just 10% of your treatment time, a lot of guys actually double their revenue with implants. So we got 10% procedure time, and it's the same revenue as the rest of their general dentistry practice. So it's a neat thing. Patients love the minimal invasiveness of the techniques nowadays, and it's not just me innovating or developing. This is from 9 practices. Absolutely.
But you're the one speaking about it.
Yep.
Out on the circuit. So tell us about the courses. How do we tell us about the courses you have? They're in Oregon.
Yeah. So we're actually opening 6 training centers throughout the U.S. However, I only teach the hands-on portion at my place in Oregon.
Right.
And so we do a 2-day course. We have a big dinner that Thursday night, and I would welcome anybody that's watching this to attend. Obviously, if you're watching this, you know Mike, and so Mike's got a cool discount for everybody watching it. Absolutely. And so we'd love to have anyone out at the course, and it'd be fun.
Now, how do we learn more about it? Do you have a website?
Yeah, do have a website. You can either go to nodrillimplants.com.
Implants plural.
Implants plural. Or osteoready.com. That's osteoready. And I think it might be up here. Maybe it isn't.
We'll put it below.
You'll put it up. So yeah, you can learn more about that. Watch some videos and yeah.
Okay, so just get with Brady Frank. If there's anything that you do in your practice, this is the easy implants. It's a high return on investment. It's just something that you need to do. I'm going to be out there. I'm going to pick the date right now. Get with Brady Frank. Brady, thanks so much for being with us.
Absolutely. Thanks, Mike.
Okay.